Good afternoon, everybody. Hi, Jennifer Maxwell, co-founder and CEO of Maxwell Healthcare Associates, today here to kick off our second webinar in a series of 3 on M&A and the process throughout what we're doing. Our previous M&A webinar really took us from a high level, kind of historical M&A trends, kind of where we see evaluations coming. And now this week, we're going to take a deeper dive with Jay Duty, the COO of Maxwell Healthcare Associates, and Cory Mertz, managing partner at Mertz Taggart. So welcome, gentlemen. I'm very excited to have a further conversation and take a deeper dive into M&A and evaluations. So our topics today, so that everybody knows, we're going to talk about financial, operational and clinical processes, technology and EMR systems, cultural and organizational alignment, and then we would love to open it up at the end for Q&A and any other follow-ups. There is an ability to put questions in your listen and mode area. If you have those, please fill them in at any point in time during this webinar, and we will hold some time at the end of this broadcast for us to be able to address them. So thank you, guys. So let's get started. Let's take the high level kind of component. Cory, if someone was looking to sell, what does it look like from an engagement perspective with someone? And how does that courting process look like? Could you kind of dive into that for us? If I was a seller and I really wanted to engage with an organization such as yours, how does that look?
Yeah, thanks, Jennifer. So for us, we mostly represent sellers. And our courting process, as you mentioned, is could be anywhere from a month to over 10 years, right? Depending on really the seller, the owner's ultimate objectives. So regardless of where they are in the process, we'll always start with that kind of objectives, understanding of the owner's objectives, and it really comes down to 2 things. From an M&A perspective, what is the value that we're going to need to ultimately want to transact, and when do I want to do that, right? And so that can range from anywhere from someone calling me tomorrow and say, hey, we're ready to sell our company. We've never talked before. We're ready to sell our company. You come highly recommended. Just give me the best deal we can, and we'll take it to market and get them the best deal that's out there. Then there's some folks that are, planners, right? And they'll come to us, and this isn't unusual. I had a client that whose agency we sold just a couple of years ago that I think we started talking in 2009. At that time, they had about a 6-year exit plan that ended up getting extended, which isn't unusual. And they wanted to get to a certain dollar amount. I can't remember exactly what the number was at the time, but we started at probably 35% of what that ultimate number needed to be, and along the way we'll check in and we'll make recommendations and just kind of continue to do what we call a gap analysis, right? Here's where the agency is today from a valuation perspective, and here's what you ultimately want to get. Regardless of the timing, and we'll do a gap analysis. And that gap analysis will really identify at a high level, some of the opportunities to improve usually that valuation. So we'll lead them in the right direction. We're not consultants. Obviously Maxwell is, but we can take it to a certain point, and then ultimately. Our client, along with oftentimes a consultant like yourself, is going to have to do the real work, right? So once that gap is closed, both from a value and a timing perspective, now we feel confident that we can go to market and get our client what they're looking for from a valuation perspective. Then at that point we'll go to market, but typically no sooner than that. You really only want to go through this process one time.
Very much. That's a very good statement, Cory. Jay, as a consulting partner in this space, how would you look at what Cory just told us and apply that to what MHA does to complete that full picture of an assessment before going to market?
Yeah, thanks, Jennifer. I appreciate that. And Cory, I didn't know 10 years was the possibility there, but hopefully a consulting firm like ours could add value and maybe shorten that deal size, deal time a little bit. But on the consulting side, we want to add value. We want to look at that asset before it goes to market. Just kind of dig deep into the details of kind of the financial and operational efficiencies, maybe clinical quality, give some strategic guidance on enhancing those pieces that will drive value to that asset before it goes to market. And we want to make sure that you're not only positioning your asset to sell, but that you maximize the value by identifying those gaps that there may be in some of the financial operational efficiencies to then go to market with more of a full head of steam. So we do a couple of things. We do an agency health check that we do on the sell side, where we kind of take a deep dive into each one of those levels to say, what does the health of this organization look like before it goes to market? And do we take a step back and take the time to enhance and optimize some of those operational efficiencies that'll make it a more valuable asset once it goes to market to identify a higher multiple? So kind of like Cory said, he's not a consultant, we're not a banker, but everything short of that, I think we can really help dig deep into those operations and say, hey, these are the things we want to improve that are just going to drive that much more value before we go through the arduous process of taking an asset to market.
That's great. Thank you both for that. So since we started talking about that financial evaluation, now that we talked high level, let's discuss a little bit more in detail about that. What financial metrics do you find that are often looked at during the evaluation process, and how can organizations mitigate associated risk? Cory, I'd love to kick it off here to you.
Sure. Yeah, thanks. So from a financial metrics perspective, what buyers will typically look at, and therefore what we typically look at, when we're assessing a company on behalf of an owner, we really look at three things, three metrics, three high-level financial metrics. First being revenue, right? Usually, the bigger the company, the higher the revenue, the more value that company will, all things being equal, will garner. Then we look at gross margin or gross profit. So that's the margins that's left over after your cost of sales. That's an important piece. I'll come back to that. And then finally, we'll look at adjusted EBITDA margin. So and what we really want to get to, and what buyers like to see is, there's kind of a sweet spot for these margins, right? These margins, the revenue, obviously larger the better, but if you look at both home health and hospice, the sweet spot for gross margin is probably somewhere between 45 and 55%. That's more variable on the home health side, and it's really a function of usually how much episodic revenue you have versus pay per visit Medicare Advantage. So the margin structures for home health can vary a little bit more. And then finally, you subtract out your overhead, and you're left with your basically left with, and make certain adjustments. You're left with your adjusted EBITDA. So we'll look at the adjusted EBITDA margin too. And so for a home health agency, that can be anywhere from 15 to really 25%, again, depending on the mix. And for hospice, it's probably somewhere between 18 and 25 is really kind of the sweet spot. So a little bit on the higher end. Now I guess I want to make two. Oh, and I forgot Medicaid. So Medicaid and VA, those can vary depending on on geography for sure. So each state has its own kind of margin profile that you want to kind of target. Depends on the state. But I think there's 2 points that I think are worth mentioning. Number one, when you're looking at your company's or when a buyer's looking at a company's margin profile, as we call it, they're really looking at it based on accrual numbers, right? So they're looking at revenue based on the date that you actually earn that revenue. Very important. Same thing with payroll, right? They're looking at your payroll based on the month that those that pay was earned by the employees. And so the idea there is to kind of line them up, and then it should really be a fairly consistent margin from month to month. So that's the idea. So number one, you want to make sure it's on an accrual basis. And then number two, we talk about that adjusted EBITDA and that adjusted EBITDA margin. It really is a variable thing. You can have in one transaction, you can have one buyer that has an adjusted EBITDA of X and another buyer that looks at the company, as an adjusted EBITDA of X plus something, right? And both can be right. These adjustments are quite variable. It's really a function of what the market will bear, right? It's not necessarily from a seller's perspective what you think the earnings are, even after accrual basis. It's really what can you serve up in the market that the buyer universe will latch onto and grab onto. So, if you look at just from a timing perspective, right? Do you look at the last 12 months? Do you look at the last 3 years? If it's a growing company, we typically like to look at a more recent period of time and kind of take more of a run rate. And if it's an attractive company, a buyer will latch onto that. So a lot of variability, not only in the timing that you pick, but the adjustments that you make, right? As an owner, you may not, let's say you're an owner of an agency and you're the leader of the agency and you're doing some day-to-day stuff. A buyer will typically have to factor in some sort of replacement or retention cost for the seller that's reasonable. And then there can be other adjustments too, but I've probably gone on too long on that piece. But the adjusted EBITDA piece, it can be very variable. So don't be tempted by, or lured by someone who comes at you with a multiple. If an advisor that tells you what the multiples are without really talking about what the adjusted EBITDA is, in my opinion, they're being a little hasty.
Makes sense. That's great. So Jay, talking about, positive or negative results from, an initial look at that asset, how does a consulting partner assist in mitigating that evaluation process based on the numbers before going to market?
Yeah, no, that's good. I think getting involved early. I mean, I think Cory, I don't think you overstated that. I think the whole adjusted EBITDA piece has a lot of different factors in there, like margin. You mentioned margin several times. There's some things you need to look at to make sure there's not risk in reimbursement or clinical quality, and just the ability of those. What operational processes are in place to ensure that that risk is mitigated. So, some of those things, Jen, I think you'd look at in that evaluation process. They're going to help with that. Is looking at your practices and your operations processes and things like revenue cycle management. Are you able to, bill claims and collect on those in a timely manner, that would be expected? I think there's a lot of times that we've had a couple where, a simple example from somebody we took a look at didn't have a write-off process. So the revenue that they were showing was much, much higher than the actual revenue because they hadn't written anything off in 9 months. And so we were able to figure out, what is the true value of that too. You're going to have some risk there when you take that asset to market because that's going to go get adjusted pretty heavily there too and may affect the multiple. So you really want to have a clear picture of that on the financial side for sure. I think the other important things there are, is this an asset that's growing? You want to see that trajectory of an asset growing. What does cash flow look like? Is there enough margin to really fund the business and to fund it to scale in the future that somebody's going to want to find this attractive asset that's growing and going forward? That financial health is going to help you make really good strategic decisions. And so we do several things on the consulting side to mitigate that risk. We do what's called a financial health check, where we'll go in and take a look at the financial health of that, make sure those processes, not just the numbers, but what are the processes producing too? What efficiency are you getting in the way in which you staff your back office or the way in which the clinical care is staffed? There's some real efficiencies and value there that somebody's going to come buyer's going to come take a look at that seller and say, hey, I think I can do that more efficiently and squeeze some more, EBITDA or gross margin out of that by the way that I manage that staff. So bringing a consulting company in, the thing I would say is, let's come in early and have a really honest talk and look at the care that's provided, but also the processes centered around delivering that care and in the back office that are going to reduce that risk of reimbursement diminishing or dipping after somebody buys that. You may be looking at everything from the platform of like, what is the mix of your your payers? Is it mostly traditional Medicare on the home health side, or is there a lot of payer pieces there that you really got to look at? If we make that transition into the managed care space, what is at risk whenever you change from, the buyer takes that from the seller. So I would say get involved early, and it's really a lot about mitigating that risk, because that then drives value to that client. You can get a really honest picture of what that adjusted EBITDA looks like. I think that, again, Cory, I probably went on too long too, but I think it can't be understated that that's important, because the way that a buyer may see that asset may be different than the seller sees it. And so how do we get kind of that middle ground, or have a third party come in and get really real about what the asset is truly going to be valued at when it goes to market?
I love that. Love that. Thank you both for that detail. And I would definitely say, I know we landed on adjusted EBITDA a lot, but to your guys' point, that is definitely something that ends up being, potentially the end all to a deal, if we can't come to those agreements, right? So I think that's really important. So thank you both. Now that we've kind of discussed the financial components and that potential mitigation, let's dive into a little bit of the operational and clinical process assessments. What do you see are the most common operational and clinical inefficiencies within organizations that are preparing for M&A? Jay, let's start with you.
Oh yeah, I'd love to take this one. I'd love to give you guys a perspective of kind of what we're seeing kind of right now as we look at assets, whether it's in consulting services for someone that's just engaged us to take a look and assess and optimize their operations, or in an M&A space too. They're kind of one and the same. What happens to be kind of, I guess everybody's looking for a little bit deeper dive, and what seems to be common today is things like intake and scheduling. How are we getting in those referrals and converting them to admissions? How are we processing those referrals, and all the different payer pieces that are there, auth eligibility and revenue cycle management? Those are critical for improving the overall performance. So a lot of times people look at the care being provided and what's happening on that side, but how are you efficient with those operational processes on the back end, in the back office, to make sure that you're really pulling through that revenue correctly too. So, workforce management and productivity, that is the name of the game. Obviously, labor is the largest cost in this business. And so centered around, what does the staffing model look like? That's one way we've been able to come in and say, okay, this asset today, whether we're engaged in the M&A space or in the consulting space for optimization, what does that productivity look like? What systems and processes are in place to have visibility to manage that human capital and workforce? And then, of course, the clinical quality. What is the documentation? What does the quality of the documentation look like that really conveys to payers and to Medicare what care is being provided there too? So we'll do that through assessments and optimizations to take a look at that operational efficiency, Of course, the quality of care, patient outcomes, regulatory compliance, those are really heavy areas right now that your clinical practices are matching the best practices in the industry. And so we can kind of run those alongside our best practices that we've seen from agencies across the country and how they're providing that care. And of course, again, billing and reimbursement, including your payer mix, the way you're managing things like denials and working those. That's kind of one thing that's very, I don't want to say popular, but that's an area of focus that people are really looking at right now. And so when you optimize those areas, you can improve that cash flow and kind of take away some of that risk on the financial side there too. So just to kind of summate there, I think intake, scheduling, auth and eligibility, revenue cycle, kind of all in one, even though we kind of look at them as separate pieces of that puzzle. That's an area that's really, really involved right now, as well as the payer space. A lot more movement towards, we might have taken a platform that was mostly Medicare in the past, but as more and more beneficiaries are now moving to the managed care space, to the Medicare Advantage space, we are seeing a lot more attention to that, and how efficient are we of where we're contracted, how we get that authorization piece through. It takes a lot more back office resource to process those referrals than it does potentially a Medicare patient. And so that's one large area of focus there. So those are the most common, all kind of centered around the same area, but that seems to be where that value can really be driven in an agency and prepare them for M&A.
That's awesome. Thanks, Jay. Cory, do you have any additional operational considerations for a seller going into the market?
Yeah, we always tell our clients, at a high level, we try to look at it through the eyes of a prospective buyer, right? The opportunity through the eyes of a prospective buyer. And, Jay has mentioned this a number of times, it really is all about risk, right? And so I just always encourage folks to look at, take a critical look at their agency in the eyes of a strategic buyer, because for a strategic buyer, it's all about risk, right? And primarily it's transition risk, right? So what's the risk that, if we give this individual, whatever their magic number is to either stick around or go, right? What are the risks that if this person's not as engaged after a closing, that the business and the cash flow starts to deteriorate. So, to kind of drill down to another level, if you're looking at risk, right, and transition risk, as a buyer, you want to understand what kind of systems do they have in place. Number one, number two, what kind of organization do they have in place? One of the first things we'll talk about when we sit down, with the buyer, whether it be a financial or strategic buyer, one of the first things they're going to ask you is, okay, great, we know what you do. Tell me about, who you got on the bench, right? What kind of leadership do you have that can continue to operate this thing if you were to check out, right? For one reason or another. So transition risk, bench strength is important. Referral relationships are certainly important, right? Buyer's going to take a critical look at, all right, if this owner no longer owns this agency, are some of our referrals at risk? And if so, you'll want to try to do your best to kind of de-risk that, right? So from a strategic buyer, it really is all about risk. It's mostly transition risk. Obviously, there's always reimbursement risk, right? Especially with government payers. But with financial buyers, now we're talking about private equity groups, family office, that are looking for a platform opportunity, so that they can get into the space and scale it and sell it. They're looking at two things. They're certainly looking at risk, just like a strategic buyer would, but they're also looking at opportunity, right? So, what can we do with this platform, right? They may say, okay, what can we do with this platform? It's growing fast. They've got a strong management team, got a lot of overhead, but that, it can support growth. In cases like that, buyers will, especially financial buyers, will overpay, for that opportunity to get into the space.
Awesome.
So, and I think, put another way, if they see that they can invest money now, right, and in 4 or 5 years, get a 4 or 5 times return on their investment, then they'll overpay for that, especially if they're trying to get in the industry.
Oh, that's great. Thanks, Cory. That's very good insight. As we were talking about platforms and things like that, one of the topics we want to dive into a little bit more is the technology in the EMR systems. As my experience in the space over the years, the industry has shown that, there are additional considerations, to the evaluation process that, and go-to-market strategy for sellers. So I'd like to start with the topic of technology on the whole. How important is EMR compatibility and tech stack compatibilities in the overall evaluation process? And then what key factors should organizations consider in making those decisions? Cory, let's start with you and EMR compatibility.
Yeah, so again, looking at it from a buyer's perspective and a EMR compatibility perspective, right? I mentioned risk, transition risk, right? If a buyer and a seller are on different EMRs, that transition risk might be a little bit higher than it would be if they were on the same EMR. So compatibility is important, I think, from a buyer's perspective. If you can get that, it's a bonus. You're not going to see it often. It's just statistics, right? There's a lot of different systems out there, and there's some really good ones out there. So chances are they're not on the same system, but if they are, a buyer might be willing to pay a little bit more because they don't see that transition risk. So there's compatibility, and then there's the other thing that we look at and the buyers look at is how good is the reporting, and are these individuals taking advantage of those reporting capabilities to the fullest extent. So it starts off with what kind of reporting package does this EMR have, and there's some really good ones out. There's a number of them that are out there that are really good, at least in terms of giving you accrual-based revenue numbers, sometimes cost of sales. In some cases, you can they'll factor in bad debt. They all have different capabilities, but at the very least, if you can get that revenue on an accrual basis out of an EMR, that's super helpful. It's helpful for us when we take a company to market. It's helpful for the buyers, gives them confidence, in the numbers that they're looking at. So I would say capability, reporting capability is a key piece of that, but also taking advantage of those reporting capabilities. There's certain EMRs, they have the reporting capabilities, but you have to close out the months, month over month over month, in order for that reporting to be accurate, right? So those two things, from not only compatibility but capability and taking advantage of that EMR's capabilities.
That's awesome. And so when we think about the technology and infrastructure tech stack, Jay, how does your organization evaluate that tech stack and provide recommendations?
Yeah, thanks, Jen. I appreciate that. This is a huge topic. I think, technology in general was kind of a nice to have. You always had to have your EMR, right? I mean, that's, to Cory's point, that's kind of driving the blocking and tackling there. And, I know, and I did M&A for a time and actually did a few deals with Cory, as we talked about on the last time. And, the first thing that somebody in the M&A space or the development guy kind of casually asks, hey, what EMR are they on? Because all they want to know is, do I have to integrate that in transition from, whenever I buy that asset, do I have to spend that time, teaching a new one? And what I learned quickly was, just because an asset is on the same EMR, that doesn't mean that their instance, looks the same from organization to organization and how they use that too, especially to Cory's point, the data and reporting factors within that, of how they define certain terms or how they look at certain financial metrics, operational metrics there too. So kind of getting on the same page, that's one of the reasons it's so important, because it is kind of a risk in transition, is how are you going to be able to operate those two assets as one post-acquisition. The other thing is, I think, technology, there were a lot of nice to haves that have become need to haves there too. So technology is really enhancing the delivery of care today. And so it was kind of, you not only need to catalog and inventory what that asset has from the buy side, you need to know, what does their hardware software look like, but you also need to know, how are they leveraging that technology to provide care more efficiently too, and then understanding, do we keep those in place? Do we bring those in an integrated asset in the future? I'll give a few examples of our solution partners. You might look at, are they utilizing Invoke for speech recognition that's cutting that documentation time for nursing? Are they using, Procura to be able to manage their documents and referrals there too? Are they utilizing Metalogics to predict what the visits they'll provide, or perhaps predicting the end of life on the hospice side? Trello, are they utilizing that market data to utilize in their sales force to make sure that they're seeing those assets and where the referrals are coming from? So there's a lot of things that, again, were nice to haves that are need to haves, that are large line items, on a balance sheet, because you see all this cost there, but how are you leveraging those to get a return on that investment and utilizing those to be more efficient there too? So a lot of those, we've got some technologies ourselves at MHA that we've developed, like Caregiver Accelerator, that's helping manage productivity. That investment in managing productivity is going to show you the availability and capacity of your branches by discipline. How are we utilizing that when we're scheduling visits? We've got Notify Nana, which is a text-based support of scheduling and then surveying after each visit to know, hey, are we going to be able to prevent some missed visits by utilizing Notify Nana? That's really going to save windshield time to make those caregivers more efficient. Like, those investments are worth that and have been seen as kind of a nice to have, but now they're becoming, a need to have. And then a lot of those center around like data and reporting too. What does that give me back Like if I've got, like we've got another product, Nana Bereavement, what we're finding with that is the feedback we're giving from patients is just phenomenal. It's just been really heartwarming to see the feedback that family members are giving about how the care that was provided to their loved one. There's some real value there in how you take that to referral sources and talk through what your patient families are saying about the care you've provided. There's a lot of value in surveying that patient to see if they were satisfied with their visit, to make sure that your HCAP scores are affected by that, because you've got data now to action on in real time to say, how are we rating how are our patients rating the care that we're giving them in real time. So, I think technology again was kind of like, hey, yeah, there's some nice bells and whistles here, but agencies have really learned how to use that and leverage that to really enhance care delivery and make sure that we're just providing the best care most efficiently when we've got our most important asset, which is clinicians in front of the patient. So, looking at that tech stack, you need to evaluate that. We've even developed, a technology assessment as part of not only the mergers and acquisition, service line that we provide, but also within assessments to say, what even are all the technologies that are being utilized? How are they integrated? How are we leveraging? How are we making sure that all the data is tied together so that we can make strategic decisions, so that we can make productivity and financial decisions, so that we can make quality decisions based on that too? How does that all aggregate, and what is your tech stack providing you to say, hey, this is now operational data that I can use to be more efficient, to make sure that I'm strategic in how I deploy my resources and in the care I provide and the quality of care we provide too. So I think it can't be understated too how important that's become. And we, of course, have really bought into the idea of it's really the integration of the people and then the process, the efficiency of the processes and the technology that are allowing agencies to provide the best care there too. So when you're looking at an asset, you need to take all of that into consideration. What is the platform? How embedded and ingrained are they in utilizing that technology to really provide the best care possible, to be as strategic as possible, and to reduce as much risk as possible in all of that?
That's
Sorry, Jen.
awesome. No, I think that's very true. I mean, to that point, tech-enabled and solutions, technology solutions, wrapping around that EMR to provide better ears to the ground on how that organization is running, as well as transparency from patient care to the back office to the C-suite leadership. Right. That's very important when you're looking at an asset as a whole, or just running an organization, right? So definitely it's on the rise and a focus of a lot of the M&A strategy and go-to-market components that we're seeing, right? And so that tech also leading into our next topic, which is culture and organizational alignment. I know some of that tech is actually to assist with organizational alignment, quicker to back to, as the asset transitions, usually the ROI goes down. How do we, speed up the, back to ROI plus, right, is part of that. But we have a workforce that sits behind that. So as we know, we have a shortage that's been impacting us for, a number of years now, and poses a potential higher risk for employee turnover and a company that's trying to go to market, right? So how significant is culture fit to the success of mergers in the industry? Cory, let's have you provide some insights from the sell side. Look.
Yeah, culture's huge, and it really goes both ways, right? When you're a buyer, you want to make sure that typically you're acquiring a company that, whose culture is at least somewhat aligned with yours. But, we mostly represent sellers. So, from a seller's perspective, it's still big, right? If we're doing our job and we engage with the seller and, that client ultimately decides they want to go to market, run a competitive process, right, with the best buyers in the country. If we're doing our job, we will, halfway through that process or so, we're going to be serving up multiple A-list buyers who are interested in presenting a bona fide offer, provided the outcome of this management discussion, which I'm going to talk about, goes well. So ideally, we've got a number of buyers that want to meet with my client. They're legitimate A-list buyers. They've got strong offers in hand, depending on how the meeting goes. And so we'll set up the meeting. Every meeting has an agenda, but it's really it's a get to know you type meeting. You're going to cover a lot of topics, but it's really an opportunity for the two parties to kind of, assess one another and develop a level of trust. And culture is a huge part of that. I can't tell you how many times, we've come out of these management meetings, hopefully have multiple offers for our client to review, and they don't accept the best offer in terms of value. They might accept the next best one, just because they feel so much more comfortable about who this buyer is. They feel confident that this buyer is going to actually get them to the closing, right, without trying to retrade. But beyond that, they're going to they're going to treat the employees the right way. They're going to this is, in a lot of cases, my client's baby, right? They and it's their legacy, and they want to make sure that legacy is in good hands. So all things being equal, once we come out of that management discussion, or even close to equal from an offer to offer perspective, the seller will almost always choose the buyer that has better cultural alignment.
Yeah, I would agree to that. We see that a lot. Jay, can you give some insights into this area from your perspective?
Yeah, I think it again is super important. I think the scary part of this, whether it's a founder-owned business that's selling a smaller asset, or if it's a strategic buyer coming in and has their own culture buying another one, I think everybody fears that four-letter word of change, right? And so and I've been in some rooms, and Cory and I've been in a couple of rooms together where that announcement is made that, hey, we're selling this business, and there's tears, right? People are trying to figure out, they don't really hear anything else that you say within that transition meeting. They're concerned with, like, okay, who owns us now, and what does this mean for me? And that do they align with my values? I've really been fond of this organization, and now it's changing, and so they get kind of nervous. And so I think that enhancing that the culture fit that fosters that collaboration and really enhances the integration of those two assets, making sure that transition is a lot smoother. And I've literally been in rooms where there were tears, where later they came back and said, you know what, this was a really good process, and we really like this. But I think it really makes people nervous there too. So we take a look at those cultural conflicts early on and make sure that we develop strategies for that change management and the implementation and adoption of things, even like the EMR. When you're implementing and adopting either the same EMR or a new EMR, it's a source of frustration for people. And so they tend to start to feel like, maybe I don't even want to do this anymore. And I think the leadership, the buyer comes in when they buy another asset, they're taking a look and saying, hey, I've got to be careful. I've really got to take care of this culture and these employees that are coming over, because if they leave, I'm going to really see a dip, and I've got a risk in them leaving, and I could really see a dip in my revenue. And so, you really have to foster collaboration through that transitional process of implementation and integration of those two agencies together. And so it's very important. I think, a lot of times it was shocking to people that the business, you would go buy something and that business would dip. Well, there's a lot tied up in that transition. If you've got people that are learning a new EMR, trying to figure out if they want to even be a part of the organization that they now, woke up one day and heard an announcement, because a lot of times this is a surprise for them, if they even want to be a part of that. So that misalignment can really lead to like employee dissatisfaction, and then start looking at turnover, and that's going to affect service delivery, which is going to affect revenue. So you need to be thinking about that early on. Messaging is one of those fixes too. So when we've worked on implementations and integrations, we call it a strategic integration plan. There is a specific documented plan and how, when, and to whom we would communicate this change, whether it be a process change or something with the EMR, or even the point of like, hey, you were sitting in this agency on the sell side and you didn't even know it. And then the buyer came in and now you've got new ownership that you had no idea was coming. And so just the process of adoption throughout that for all aspects of that, whether it's the blocking and tackling of provided care, or just how they feel about, culture and retention, are enormous, and they're kind of these X factors. Whenever a buyer is looking at that, they really don't know what the impact's going to be. So you really need to be thinking about that before you ever sign on the dotted line to buy an asset of what is the plan for integration, what is at risk, and you need to mitigate for that risk and really plan to manage that change and get the organization to adopt that employee's culture and create perhaps a new culture when they combine too. So again, I think we've had that as kind of a theme. It can't be understated of how important that cultural fit is.
Yeah.
Absolutely. And I think, you both mentioned communication plans. And I think, in my history of doing, the transitions is if we don't have the communication plan that goes down to the field staff and how that kind of rolls out and transitions, it can be pretty disastrous at the end. And, there's a lot going on. And then the other piece of that is as simple as changing a title. If one organization uses different titles versus another organization using different titles, and if they're going to change, that can impact more than anybody will ever understand, because it becomes a self, an integrity. This is how I define myself as an employee of this organization, right? Like, so when we think about that, that's a huge deal. Cory, you had something to add to that.
Yeah, I was going to add one other point on the culture piece, right? And we see this a lot too. We have clients who will say, I don't care who the buyer is or what their culture is. We just want the best deal, right? And our goal is to get them the best deal, but it's also to educate them, right? And something you always need to consider is, you might be able to get the best price from a certain buyer, but if post-closing and you're gone now, right? You've left the company, things don't go well. That buyer could be a little bit of a pain in your butt for a little while. For no reason, for nothing that you have done, right? But they are kind of your business partner a little bit. Every transaction is going to have a holdback for any kind of indemnification claim that a buyer chooses to make along the way. It's not a ton of money usually, but it is significant. And so, that buyer will be holding on to some of your cash for a period of time, but there will also be an indemnification package with all sorts of reps and warrants. And I've seen it a couple of times where buyers have come back and because things didn't go well, try to blame it on the seller, right? They didn't represent something right. And in both cases, the seller, who was my client, right, they were completely exonerated. Nothing, they were in the clear. But it was a process. It took a lot of time and energy and attorney costs and everything else. So you really should be thinking about beyond just that. Maximizing that dollar is how are they going to treat the company post closing?
Yeah,
it could affect you.
Cory, that's a great point, Cory. I'm glad you said that. That's, everybody always thinks that maybe the holdbacks are really centered around reps and warranties, but to your point, that's largely cultural. It's not even necessarily financial. It's just the fallout from what people perceive as what was represented, who the people are, if they're going to stay, if they're going to retain too. That's a wonderful point.
That's a big deal. And I would also say too, when you think about that organizational alignment, obviously, towards the end of the deal, everybody's renegotiating a contract, from the sell side to, be still on the leadership team or the management team or whatever part of that. If you don't have a cultural alignment and, a great communication plan, those negotiations of contracts can hold up the close of a deal as well, because if you want those key people to come over and they're going to fight you on the contract, on their personal contract, because now they're bidding for themselves, right? They now get to negotiate because the owner is selling, they've lost rights to that contract. Now it's all new fair game, right? So we want to make sure that everybody's aligned on that. I've seen deals stall for months because the leadership team that was coming over decided, I'm not happy with this. I wasn't involved in this. I don't feel like I was part of this. And so they fight on that piece, right?
For sure.
Yeah, they can hold the deal hostage, I guess, for lack of a better term. We've seen it a time or two.
Yeah.
You know, our recommendation, is always to try to, especially the leadership, the key leadership, try
Yeah.
to involve them somewhat early in the process, provide some incentive for them to stay involved and to participate, and that will typically help sometimes mitigate that.
Love it. Love it. Well, this has been such a great deeper dive and fruitfulness in this discussion. We got into a lot of detail on that seller side and, on what to be thinking about. And so we have about 15, a little less than 15 minutes. Cory, Jay, I'd love for you both to take a stab at what you see as key takeaways from this discussion today. Jay, I'll start with you.
Sure, I appreciate that. Yeah, this is a great discussion. And I think one of the key takeaways is who are you aligning with on the sell side? It's time to transact, right? So I think Cory has shown, and I hope we have as well, that it makes sense to get some trusted advisors alongside you to kind of walk through this process and tie those things together, where it's a banker and a consulting firm. And I think that synergy is really important and key there. I think going through a thorough evaluation process before you even get started, I think is something that we really highlighted today. To look clearly at the financial and operational metrics and the assessments of those efficiencies is super critical. And I think you get the opportunity to do that, get really clear and honest early on with the seller. The seller can look themselves in the eyes and say, okay, what does my value look like to the buyer that I want to attract? And then, a lot about the cultural alignment we talked about ties into this is a people business, right? And we provide care to patients. These agencies do. And so whenever you're in front of those people, you've got to have a really good look, intense hard at not just the productivity of those employees, but also the cultural alignment they have, because that's ultimately going to lead to quality. So you have to dive into the clinical, the financial, and the operational pieces, understand those deeply, but also understand the health of that asset. And as a seller, I think understanding the health of your own asset and what that would attract. So those are things that stood out to me that can't be understated. As our theme has kind of said too, is cultural alignment has to be there, but you really need to look thoroughly at the key metrics and those efficiencies of how the business is run, and not just what's on the EBITDA line, but what does it take to get there too? And of course, the technology piece of how we integrate the people, the process, and the technology to do a really good job providing care and to mitigate the risk for the health of that asset when taking it to market.
Great. Cory, your
Yeah,
thoughts, key takeaways?
somewhat similar. Number one, I would say, if I haven't said this, it really is never too early to start planning, right? And getting aligned with someone who will give you candid guidance. And again, I talked about kind of the beginning stages of, okay, start thinking about, if you haven't done this, when would I want to sell, right? And ultimately, you're going to exit the company, right? Or you're going to transact at least, and then ultimately exit. But try to have an idea when you think that might want to happen, or when you think you might want that to happen. Where are you today from a valuation perspective? And then start planning, start looking at that on a regular basis, month after month, quarter after quarter, year over year. So it's never too early to start planning. Number two, I like the term, Jay, you've used a couple times, thorough analysis, or a thorough valuation. This is, I guess, slightly off topic, but I know there are a lot of advisors. Some are brokers, in some cases buyers, right? If you're an owner, you're getting approached by these folks pretty regularly, and it's not unusual for them to come at you with a really high multiple, right? Oh, we've got buyers that are paying 7 to 8 times for a company like yours. Well, I would probably stop right there and ask them, well, what do you know about our company? You really don't know anything about our company. So how do we're going to command a 7 or an 8 without knowing anything? Have you looked at accrual numbers? Have you done the thorough assessment? have they done a thorough assessment? So don't be lured by multiples, especially lofty multiples, and because it's easy to get kind of sucked into a deal by a buyer or a broker by these lofty multiples. It's much better to plan it. Plan your exit, look at, really get a sense for what the value truly is, not just the multiple, but the value, because that adjusted EBITDA can be so variable. You want to get it from a trusted source. And I guess I'm kind of tooting my own horn here a little bit, and I think the thing I failed to mention before, when we give valuation guidance, we really try to be conservative. We don't look at that valuation as an opportunity to pump our chest and tell you how much we can get for your company. That is not the intent, right? The intent is to give you a straight answer on what we think, if we were to go to market, you could get for your company, so that you can make a sound business decision, right? Whether or not to go to market or do some things to get me that number. So, it's important that you, if you're going to get a valuation, it's from someone you trust. It's someone who's done the basic conversion from cash basis to accrual basis. They've looked at the margin structures and they've done a thorough analysis of the company.
That's awesome, Cory. Thank you. That's really great. We have a few extra minutes here, and there is a question from our audience. And Cory, I think you might have mentioned this earlier. We were talking about gross margin and kind of like a target at that 55% was mentioned. Can you clarify, kind of what goes into that?
Yeah. So if it's I'll just clarify maybe a little bit more. For hospice companies, I think a target healthy gross margin might be somewhere between 50 and 55%. Usually is, there's extenuating circumstances that may not allow a company to generate that, but that's kind of the sweet spot that buyers like to see and will typically use in their models, quite frankly. So that 55% based on accrual numbers, right? It really factors in so the gross margin is your gross profit divided by your gross revenue, where your gross profit is your revenue minus your cost of providing care. So how much are you paying your clinicians, the burden costs of your clinicians, their travel, supplies, et cetera, et cetera. So all those things go into cost of sales. So it's revenue minus cost of sales gives you gross profit. That gross profit divided by revenue is your gross margin. I see the note. It seems high. It might be. It might be high for especially if you're a Medicare home health agency and you're doing a lot of Medicare Advantage. It is hard to get to 55%. That's the very high end that you can really sell in the market. I wouldn't. 50% is good enough.
Yeah. Well, and I think to that point too, when you think of, everybody, wants to see, what the true margin is, right? You got to consider buyers are really looking at that gross margin because they're thinking of what are the other overhead costs that will get absorbed within their organization, right? So, what they're paying for rent and what they're paying for insurances and the benefit packages and all those other pieces tend to, get absorbed within the buyer, correct? And so I think that helps to clarify too, why we're not looking at, the actual margin after everything, right?
Yeah, that's right. That's right.
Yeah. Yep. Yeah. Jay, do you have anything to add to that from a consulting perspective on how we're looking at revenue or rev cycle or those types of things? I think of DSO and cash flow and some of those pieces that come to mind that kind of feed into this kind of margin discussion.
Yeah, I think processing a lot of that is too. I think so much of this just goes back to managing the workforce, right? I think a lot of this is those margins being managed by how efficient are you with your resources, ensuring that the time spent is providing patient care. So with labor costs and people costs being your highest, I think a lot of those discussions are really driven by what's the efficiency that you operate under too. I mean, that's where so much time is spent looking at org charts and modeling out the staffing plans to make sure that the clinician side of that, the back office side of that are just as efficient as possible too. But I think, the way that you would be able to prepare for this if you were to be a seller were, make sure you implement regular audits to make sure you're understanding, your financials and maintain clear reporting, and then data. How are you looking at data? Because that buyer is going to kind of want to come in and take a look at you as the seller, and the first thing they're going to do is request that data from you to really get a picture of you too. So I think, in the discussion of margin and what they're looking for and what goes into that, how do you maintain a clear data path to show kind of who you are on paper before they kind of meet you in person, right? So the first thing you'd want to do is make sure that they've got a clear picture of what your organization looks like.
I think that's great. I mean, I think, the other piece that I hear, when we think of having a partner on the sell side and then a consulting partner also on the potential sell side is being able to tell your story before you go to market, right? If you can't tell your own story, it becomes very difficult to negotiate what you feel and see as the value of your organization. And the more you know, the more you can leverage, right? I think to that point. So great conversations. I don't see any more questions coming from the audience today, and we're right about to the top of the hour. So I think this has been a most wonderful discussion as it relates to M&A and taking that deeper dive. We appreciate all of you who have joined us today. There will also be a recording coming out, I believe. So, and if there is any other follow-up questions, please don't hesitate to email us. We are happy to follow up with anybody after this webinar. We do have a third webinar coming up. That'll be our final webinar in the series in 2 weeks. So we look forward to having you join us. And thank you all. Thank you, Jay. Thank you, Cory. And thank you all in the audience.
Thanks, Jennifer. Thank you, Cory. Appreciate it.
Have a great
Thank you.